Okay, it is time for Ask the Vet.
Good
Dr.
morning.
Joel Conn from Pismo Beach Veterinary Clinic joins us this morning. He is going to talk about coughs. I've got a cough. Maybe you can diagnose what I've got going on. I
don't want to lose my license here, so let's keep it to pets.
Okay, well, we'll do that.
But yeah, so I wanted to talk about coughing because coughing is virtually never normal. So unlike the cat that occasionally vomits, you know, a hairball once in a while, or your dog that sneezes, coughing almost always indicates something's wrong.
Okay.
And that something can be really, really serious or it can be pretty mild. So we're going to talk about some of the causes of cough. So in general, the list is infection. So the classic here is kennel cough. Foreign body, this time of year we're worried about things like foxtails like we talked about last time. Allergies, bronchitis, even asthma, especially in cats, can lead to a cough. Things like pneumonia, cancer, heart failure, parasites, and that would include things like heartworm disease, lungworm even, which is not terribly common in this era, but we occasionally can see that. And one that you don't think about very often is toxins. Things like rat bait can cause a cough, some things like that that are irritating or can cause internal bleeding. So the way we kind of look at coughs and the way you can help your veterinarian make a decision is pay attention to the character of the cough, when it occurs, and if there's any sort of a pattern to when it occurs. So coughs in general we kind of divide into a few categories. One would be kind of a loud, goose honking, dry cough, often that ends in sort of a retch. So the classic example of that is the cough, 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 kind of thing that you'll sometimes see your dog do. That's more of a dog thing. Coughing with excitement or pulling on the leash is a very common thing we see. Again, this is more of a dog kind of a thing. A productive or moist cough, so a cough that sounds kind of moist to it, you can hear rattling in the chest, or that results in bringing something up. And then finally kind of a soft cough, mostly at night or at rest. So pay attention to what time of the day it occurs. Is it associated with excitement? Is it associated with eating or drinking? Is it worse when on leash? Because these are the kinds of questions we're going to ask you, and that can help to differentiate what's going on. So when do you need to be concerned? And, you know, I divided this into a few different categories based on severity. So an emergency, when you should seek veterinary attention immediately, would be a cough that results in bringing up blood. So that's an obvious one. That would be, we'd be concerned about things like cancer, we'd be concerned about rat bait, toxins of that nature. A cough that results in difficulty breathing. So your pet is actually now focusing entirely on breathing. It's coughing so much that it kind of ignores the world around it. It's just trying to get the next breath. You may even notice that its lips, or gums rather, tongue is turning a little purple. That's a dog that needs to be seen immediately. Choking obviously kind of goes in that category. And then, of course, any animal that becomes unresponsive or less responsive to their environment should be seen immediately. An urgent cough, something that you probably should take your pet in the same day, or at least get an appointment as soon as possible, would be a dog that's acting sick. So, you know, a lot of times a cough is not associated with any other symptoms, but if your dog is coughing and acting sick, has a poor appetite, that dog should be seen. A new cough in a young pet, like a puppy, or an older animal that maybe has a weakened immune system, that animal should be seen right away. And of course a cough that comes on suddenly, you know, one that's keeping the animal up at night or maybe keeping you up at night, you know, get that checked out immediately. And then probably less urgent, but something that we still would recommend being checked out is more of a chronic cough. So a cough that you've been observing for weeks or months or maybe even years, don't ignore it. You know, that's worth getting checked out because again, it's almost never normal.
Right.
And a lot of times we can help your pet out with that. So anyway, it's a broad category.
Well, it's good to know, though.
It is good to know, but especially with like allergy season going on. Maybe some people think it's associated with allergies, but it's actually more serious than that.
Very good. And if you have a question about your pet's health, all you have to do is email it to askthevet@kcoy.com. Thank you, Dr. Joel Conn. Always a pleasure. Stay with us. We'll be right back.
Down Puppies brought to you by Pismo Beach Veterinary Clinic. Your best friends, best